You know, you just finished a session, development to term, and you said just a moment ago that you're a clinician and you're not a basic scientist. So what struck you at that session? What were the things that really you think about and how they resonate as a clinician?
It's a great question. And looking at my life in clinical medicine and clinical investigation, I've always felt that practicing clinical medicine to a high level, a thoughtful level, an evidence-based level is something that we should all strive for, and something that can advance our care and advance the science of medicine. Clinical investigation feeds in very seamlessly into clinical care. But I also feel that unless we develop the basic science foundation of our disciplines in maternal fetal medicine, in neonatology, in obstetrics, in pediatrics, that clinical expertise, that clinical investigation will flatline. It will not advance. We need to understand these disorders, these pathologies on a very basic level, on a very molecular level. So it's very exciting for me to hear about issues related to the immune system in pregnancy, to new biomarkers, to how some of the new technologies that are being developed can lead to new discoveries, new ways of predicting disease, and hopefully new ways of treating disease. Precision medicine is the path of the future. And as an obstetrician, I feel in a very privileged position because I think precision medicine starts at conception, if not earlier. The mother and her genome and her environment are huge in all this. And I think these talks informed that and highlighted that and helped advance that concept.
You know, I asked Renee Para, what do you marvel most at in her field, and she says, I marvel most that we're even here.
Right, I can't, there was a speaker who talked about how gastrulation is the hardest part, the hardest thing you will ever do. I think that might have been Renee who said that. And it is amazing. It is amazing to think of the images that Barry Bear showed of how we started, how we developed from 2 cells and 4 cells into the complex human beings that we are, how our minds work, how we react to things in the environment emotionally, intellectually. How much of this is pre-programmed? How much of this is influenced? We're at a threshold of knowledge and the ability to understand and hopefully impact in a positive way that I think has never really existed before. And I find that very exciting.
Now, I was told to ask you about why you became a high-risk obstetrician, that there's a great story there.
I did medical school in Milwaukee, Wisconsin. And at that time, you did a block rotation, 4 weeks of gynecology, 4 weeks of obstetrics. And I had done, before the OBGYN rotation, I'd done trauma surgery and I'd done internal medicine. And I just finished my gynecology block, and then the next morning I was going to start my OB block. And I was on call with the team on gynecology that night. So in order to orient myself for the morning, I wandered to labor and delivery, and a very nice nurse naturally asked, well, who are you? And I said, well, I'm a medical student, I'm starting in the morning. And just as we're chatting, they were wheeling out a patient who was clearly in distress, massive hemorrhage, obviously, and rushing her into the operating room. And this nurse who had stopped me and asked me who I was says, okay, come with me, stand in that corner, don't say a word, don't talk, and don't touch anything. And I said, okay. And she put me in the corner, and there was an emergency C-section on this patient. And this is very early in the morning and middle of the night. And the surgery began. And again, I had seen surgery before, but out came not a liver, not a gallbladder, but a human being. And it was for me, an intensely emotional moment. And I thought, this is what I want to do. This amazing mix of medicine, obstetrics, emergency, surgery, high-risk obstetrics, and its impact, the potential impact you can have on families, positive impact, has moved me then and moves me to this day.
So when you heard a presentation today by Virginia Wynn about, I want you to think about the placenta in different ways, what did you think? What did that stimulate in you?
It stimulates in me how, for time immemorial, we have delivered the baby and tossed the placenta as if it's a waste product. And yet this organ, this placenta, is the vehicle of life. We know so little about it. It is from this organ that interface, the maternal-fetal interface, occurs, that a fetus is nurtured, that a fetus is oxygenated, and yet it just comes out and is tossed. And only amazingly, recently have we had maybe the means, the ability, the desire to see things differently and look at the placenta in a different way. I remember when I was an intern, one of the most beautiful things I heard from a young woman that was delivered. She didn't speak English, but we delivered the baby. Then the placenta came out, and she asked the nurse who translated, "Are these all the periods I have missed?" Meaning the placenta. And I thought it was a very poetic description. But we've taken the placenta beyond poetry. We've taken the placenta to understand it and try to understand it, because I think therein lies so much of the major obstetrical syndromes, if we can better understand placental development.
Why is a conference like this important?
This conference is so unique in that in really short talks, these talks do not go on for 40 minutes, 45 minutes. These are open session conversations in a very casual yet innovative and exciting environment. People can present research, present new ideas, contextualize them to a clinical scenario, and imagine a different future. And I think it takes this level of coherence and discussion to achieve that.
And when you sit in a session like today and you hear what you've heard, and you're a clinician and you deal with pain, what do you most marvel at? What has most propelled the marriage of science translation to the clinic?
You know, I think it is a testament to an open human mind, a willingness to look at a process that has gone on for thousands of years, for millennia, that has caused in many ways devastation as well as beauty. Birth can be beautiful, and yet having grown up myself in North Africa and the Middle East, birth can leave scars. And to see how we have advanced, I think that's not celebrated enough. When you look at maternal mortality and what we have done with maternal mortality.
Globally, you're talking about.
Globally, yeah, and certainly, at least in the developed world, but yes, globally too. There's much work to be done. But it's been, if there's ever a success story that I don't think is appreciated enough, it's obstetrics. It's what we have done to reduce death and morbidity of mothers and babies. Much work remains to be done. But just if you step back and look at that trajectory, there is cause for great optimism.
Great. Thank you.
Thank you very much.